Hello, welcome everyone to the 2023 virtual summer school series entitled Fostering Health and Wellbeing Across Extension. We're excited to have so many of you joining us today. My name is Emily Smith. I'm a program associate in the Community Professional and Economic Development Unit at the University of Arkansas System Division of Agriculture Cooperative Extension Service. Before we dive into our session, I just wanted to remind everyone about the Zoom Q&A feature we'll be utilizing today. If you have questions, we would love for you to contribute those questions to our presenters so they can answer them. But please post those in the Q&A box throughout the session, and we will try to answer as many questions as possible. And if we run out of time, we will convey those questions to our panelists so they can answer them after the fact. Like I mentioned, Celeste, we have, in addition to Celeste, we have another co-facilitator. And so firstly, let me just formally introduce Celeste Carmichael. She's a program development and accountability specialist at Cornell Cooperative Extension. And also we have Nancy Calix, civil rights compliance officer for the land grant program at Kentucky State University. Thank you both so much. And they also have expertise in this area. So today's session is focused on promoting health and well-being for employees. Taking care of our own health is paramount to being a successful employee. This session will feature a few states and what they're doing to promote health and well-being through employee development wellness programs. The programs that we're going to feature today include Cornell Cooperative Extension's public health course, Utah State University's Be Well Rewards program for employees, and then Virginia Cooperative Extension's physical activity and Parsi lab work. And so I'm going to read off our panelists and their really impressive bios. And firstly, I'm going to introduce Samantha Hardin. Dr. Samantha Hardin is a behavioral psychologist and a 500-hour registered yoga teacher, which is really cool. She has over $29 million in research funding and has produced over 100 peer-reviewed journal articles in her first decade as an academic. Her relentless pursuit of perfectionism made her successful, but perhaps less healthful. And so yoga practices of mindfulness, breathwork, and movement really changed the course of her life. And so she really aims to share the science, philosophy, and practice of these multi-level approaches to health and wellness so that together we can all flourish. And she'll be talking about a lot of that today. We also have Gabriela Mirza. She received a Bachelor of Science in Psychology and a Master of Science in Health Education and Behavior from the University of Florida. She serves as the Extension Health and Wellness faculty and co-lead for the Health Extension Advocacy Research and Teaching Initiative, HEART, which addresses the opioid epidemic and other public health issues through education, collaboration, stigma and harm reduction, and resilience development. Gabby's work focuses on the role of healthy eating, physical activity, resiliency skills, and other healthy behaviors, and the role they play in decreasing injury and chronic pain, and how developing and utilizing those skills can be essential in substance use disorder recovery. Last but not least, Adam Hughes serves as a state extension specialist with Cornell Cooperative Extension. His role is to support Finger Lakes and Hudson Valley regions to provide leadership and expertise that enables county associations and their programs to work effectively, and also leads, facilitates, and supports statewide initiatives. Mr. Hughes is the Co-Associate Director of Community Engagement and Advocacy with the Cornell Center for Health and Equity and a liaison to the EPOC Health and Wellness Group. So I'm really excited for all you all to get to hear from these panelists. As you can tell, they're really impressive from their bios. And with that, I'm going to turn it over to our first speaker, Dr. Samantha Hardin.
Thank you so much, Emily, and thank you to everyone who's been just so meticulous in providing an incredible virtual summer session, and seeing so many different logos and universities and program areas covered is so important. And I love this opening question because it really helps dive right into what I want to talk about. And you'll notice that none of us really put being on Zoom, bringing us joy. It's all these things that happen kind of offline, perhaps in nature and with loved ones. And as extension professionals, we're really motivated by, helping people live their best life, finding time for these things that make them feel alive. But we can only give from our overflow. So as Emily mentioned, I'm going to talk about the 3 yoga kernels of movement, moment-to-moment awareness, and breath work, and how that might help us flourish. So I want to start with a brief pause. I will time us. So it's 3:09 Eastern. I'll give us till 3:10 Eastern to just take a moment to find sensation of groundedness and coming together for why you signed up to be here and perhaps what you're excited to learn about. Maybe that means you need to grab some water, check that final text message that's hanging over your head, or just take a couple of minutes to stack your head over your heart and your heart over your hips and relax your shoulders away from your ears. Perhaps thinking about that thing that brings you joy and aliveness, maybe hearing the echo of a giggle or smiling at the last time you saw a beautiful sunlit sky. And just take a couple of moments to notice the sensations that are happening in your body, maybe relaxing your lower body a little bit more, and just deeply breathing in. And on your exhale, surrendering the shoulders away from the ears. If you're back and with me from that text or that water break, just taking 2 more deep breaths in and out. Last time in and out. So I start with this as just one of our many infographics that my lab has produced to help us find moments of mindfulness. And you can download this, you can adapt it for any way that serves you. And I share on the screen here that these are just 3 easy steps to start any gathering. I use this for every lab meeting, every direct or in-person or synchronous training that I do within Extension, and any classroom setting as well, particularly with our adult learners who are really trying to balance all of the things happening in their life, and learning from extension professionals and volunteers is just one of the many things on their priority list. So giving them a moment to ground and you a moment to ground, leading by example. So these are the 3 easy steps and 1 key takeaway that you might be able to leave this presentation with. So to give a little bit more context, I do have a QR code in the bottom right corner if you want to snap a shot of that, but Emily and Cheryl will also share a couple other resources related to how I'm using other unique dissemination strategies to talk about this information in a new way. One is a podcast called Higher Vibrations in Higher Education, which I'll share a little bit more about on the next slide. We have other videos and infographics that you can follow along on your own time to do these mindful moments for breath work, journaling, and other activities. Starting this fall, I will be offering live Zoom yoga classes from 12 to 12:50 Eastern that any extension professional or volunteer can attend to really refill your cup kind of on the lunch break. It won't be lunch break for everyone across all of the time zones, but an opportunity to come together. And then I'll wrap with a little bit about the science and practice if you're looking to replicate these types of things in your state as well. I wanted to pause and highlight why this podcast is so exciting and important to me. I am a behavioral psychologist and dissemination and implementation scientist. And that dissemination and implementation science was really started in Extension when we were disseminating information that was developed by university professionals and getting that out into the field. And we've been this exemplar dissemination implementation science laboratory for over 100 years, but sometimes people still don't know what Extension does or what it could do for them in their life. But on this podcast, we talk about what extension does, but also how certain extension professionals, such as David Buys, Luke Arison, and Alicia Shipley, are integrating their own wellness practices as they're trying to help others as well. So perhaps these are some familiar faces and names that you've worked with as well. So please do tune into those conversations to hear how they're trying to thrive and flourish within extension as well. So I keep saying this word flourish and thrive, particularly on the opening slide and on the last slide, because perhaps we've heard a lot about burnout. And burnout is a real phenomenon that started in healthcare and social work and other public health entities. And some preliminary data shows that extension professionals are experiencing this too, but we're not really talked about at the national level in this way. But we're doing a lot of exhausting work as we're trying to help people feel financially well, engage in healthful diets and physical activity, and really flourish in their life. And they might come and share information with you that's hard to hold space for and let go of so that you can deliver the next program and the next program. And so how do we look at burnout and job satisfaction? And one of the ways the End of Burnout author articulates burnout is that you're on stilts and your passion is going one way and all of your constraints are going the other way, and you're literally splitting in half. And so job satisfaction isn't just about money, it's about the social, emotional, and perhaps even spiritual benefits. And I know that every time I step into an extension space, the sense of community and our deep roots, not just in our own county, but within our whole entire state or national system, is something that really drives our job satisfaction, which is helpful because burnout is actually recognized as an occupational phenomenon by the World Health Organization. So many individuals were experiencing burnout that this became something that we needed to address in the clinical or health sphere. So what can we do about it? How can we avoid burnout? Well, we can instead promote flourishing. And instead of focusing on things like our blood glucose level or cancer recurrence or mortality and morbidity, we can start to really focus on the things that make us thrive, like happiness, mental and physical health, meaning and purpose, character and virtue, our close social relationships that we saw in the chat about what makes us feel most alive, as well as financial stability. And so these 6 domains are part of the Human Flourishing Index. And if you're interested, that's only 12 items to help you assess how your participants might also be flourishing or lacking, and give you an opportunity to intervene as well. But you can also take the Flourishing Index and see how well you're flourishing. And for me, from my research and from my personal experiences, movement, breath work, and mindfulness are some ways that I can help myself flourish. I want to go through what each of those mean in the context of yoga kernels for public health, and then we'll go through a brief example. So first, I want to talk about movement. Often when people hear yoga, they see this picture or image that's happening in the media that's kind of taking what yoga is and moving it away from what it could be. And really the movement or the asanas or postures is just a limb of yoga to be able to sit. So it's not necessarily twisty, bendy postures that look more gymnastics like, but it can be. But more importantly, any movement done mindfully can be a form of yoga. And just like physical activity is any bodily movement, and exercise is any purposeful physical activity, you can choose how your yoga fits or doesn't fit physical activity, exercise, or movement definitions. Also, breath work. This is really emergent in the literature, and every time I experience it, there's different breathing patterns available to help you elevate your energy or calm your energy as needed based on your context. And then mindfulness is really nuanced. It's really associated with all the limbs of yoga, but mindfulness is really awareness of the present moment, and meditation is purposeful mindfulness. So just like exercise is purposeful physical activity, meditation is purposeful mindfulness. So just giving you a couple of definitions and backgrounds about how extension can implement this within their own systems for employee wellness, as well as providing it as an intervention for public health as well. And in order to really drive this home, of course, experiential learning is a great opportunity. So checking in on my time, I'd like to invite you, if you would like to follow along, or feel free to do whatever serves you. If you'd like to follow along, just again, stacking the head over the heart and the heart over the hips. If your feet are on the ground, pressing them into the ground or the earth, or just noticing the supports beneath you, if you're standing or seated or lying down. And notice what you notice as you take a moment of stillness. Is there any tension in the body? And can you send soft breath to that space? Maybe leaning away from the computer actually, and give yourself space away from the digital surface. Let the shoulders drop behind you. And if you like, reach the arms up and overhead. And then just exhale, bring the elbows down. Twice more, reach the arms up and overhead and bring the elbows down. Last time, reach up and overhead and squeeze the elbows down. Stay here on center or start to twist one way or the other. Maybe the back of your chair is behind you and you can find a light grip. The arm can stay bent or reach out in front of you. You're just working on twisting from the belly button and up, staying still, or if some movement is calling to you, just taking what you need. And on every inhale, reaching up, and on every exhale, twisting around and back. Just showing that we can do this from our desk, from our office, or even when we're stuck in traffic, whenever we need. On the inhale, come back on center, and exhale, take it to the other side. Again, using the back of your chair if you like, or hand can be on the thigh as a helpful lever as you lift up and squeeze out and back. 2 more breaths, rising up and exhale, squeezing down. Again, taking any organic movement that serves you, or just twisting from the belly button and up. 1 more deep breath. And exhale, release. Hands can come to the thighs as you draw the chest up and forward, lift up, maybe the gaze follows, and then press the back body behind you. 2 more just like this. Inhale, reach, and exhale, press back. Inhale, reach, and exhale, press back. That's 6 different movements of the spine. 1 more movement will reach up and overhead. Hand can come down to the thigh or the armrest if you have that, and hinge to the side, lengthening both sides of the body. Let the breath be soft in the throat. Reach. Inhale, reach up, and just take it gently to the other side, only as much as you need. It doesn't have to be leaning all the way over. It's just finding length on the side, moving our bodies after perhaps some sedentary time as we're sitting on our Zooms or moving from meeting to meeting. Come back on center and exhale, hands come down by the side. Roll the shoulders back, maybe taking a neck roll or bringing one ear to one shoulder and one ear to the other shoulder. And then come back on center, maybe finding a soft gaze, maybe gazing down the nose or closing your eyes, maybe left hand on heart and right hand on belly, or hands on the thighs, whatever works for you. And just notice what a little bit of movement activated for you. Breathing deeply in and deeply out. And thinking about how you want to flourish this week, this summer, this season, and this year. Maybe thinking about something you need to do to protect time to do the thing that brings you the most joy. And gratitude for what your body can do at this time, at this stage. Non-judgmental awareness of all the greatness that you bring to Extension and to all the communities you serve. Breathe deeply in And exhale, sigh, let it go. I hope you enjoyed just a brief opportunity to experience what movement, moment-to-moment awareness, and breath work might do for you. Again, these are free, accessible practices that you can do anytime, anywhere to help you come back to the present moment so that your cup is a little bit more full as you're trying to help others as they flourish. We've done a lot of work related to the study of whether or not these practices help people flourish. You can check out more about this in our peer-reviewed journal article, where we compare kind of lunch and learns, but they were morning practices compared to a 2-day retreat, compared to a 9-week program. And really the reason for me sharing this is that you might be looking at different factors, like how many people can I reach? How effective will it be at improving job satisfaction or flourishing or a sense of community, picking your right effectiveness outcome? And then who delivers it? Do you partner with your local human resources or your wellness program? Who's delivering these activities? Do you want to partner with the Parsi Lab? Is there someone in your state system who's a registered yoga teacher who would love to serve the community in this way? How can it be implemented? And then how can it be sustained? And so if you want to replicate this in your state, really beginning with the end in mind as you begin to plan, determine who your partners are, create consistency so that other employees know what to expect from these opportunities, and then create goals and clarity around why you're doing it. So that's what I was talking about with the effectiveness outcome, things like, do you care most about flourishing, or do you care most about presenteeism? Do you care most about blood glucose or weight loss? There's a million different outcomes that you could measure if you wanted to replicate this in your state as well. And to wrap, we have myriad free materials available on parsilab.org, PARCILAB.org. We have all of our mindful meetups recorded that include things like journal prompts and breath work and movement. We also have a suite of PDFs or infographics that you can download and share with individuals, such as one of our favorites is our Zizu Zoom in and out of movement when you're on Zooms back to back. So how can you incorporate some of these mindful, intentional opportunities to be active together? So with that, I'd like to thank you so much for your time, and ending with this concept of mindfulness and understanding of what self-care looks like for leaders of extension. So mindfulness, understanding self-care, leaders of extension is put a little muscle into all that you do. And I look forward to seeing what the other panelists are going to share with you, and then answering any of your questions during the Q&A. Thank you. And I will hand it. Oh, okay.
Oh, no, you're right. Yep, you're going to hand it right over to Gabby. Thank you so much.
All right, thank you. I will start my presentation. Okay, and you guys can still hear me okay, right? Nothing happened with my, okay, perfect. Well, as I was introduced at the beginning, I don't have to go through it totally all as far as my introduction, but I do work with the Utah State University Extension. I'm one of the HEART faculty, which addresses opioid overdose prevention. And some of the areas that I work in specifically are injury prevention, chronic pain management, resiliency building, those kinds of things. And so I wanted to talk about, or I was asked to talk about our university rewards program for employees, which is called the Be Well Rewards Program. And so just kind of a little bit of a background into what the rewards program is. It's just like pretty much any employee rewards program. If you guys have one at your university, it's an incentive program for our university, for the USU benefited employees. So anybody is able to, anybody who's a benefited employee can go on the Be Well website, they can register. And and do a bunch of different, they complete a bunch of different tasks throughout the semester. Usually it's always in the spring and the fall semester. They don't have it in the summer, just because obviously there's more faculty on campus in the spring and the fall and more employees and all that good stuff. So, there's normally an assessment. There's a couple of assessments that an employee would do. They have an online step tracker so they can track their steps, and also an activity calculator, like an activity conversion calculator that converts activities into steps. There are different activities that each person would focus on. So for example, they have them in 3 different areas. You can live well, work well, and be well. And I kind of have this enlarged so you can read what kind of qualifies under each one, or what each one really kind of looks at, or what it entails. And all of these activities focus on improving your physical health, your mental health, and also your community connections, how you connect with your coworkers, how you connect with your family, how you connect with the neighbors in the community, and your community on a larger scale. So the partnership actually started, it was a little happenstance, I guess. If you can think of a line, and on one side you have the Be Well program, and on the other side you have USU Extension, then you can kind of think, that's kind of how this partnership started. We were on these separate ends, but when we came together, we found that we had very similar goals, and we've been wanting to work together. So with the Be Well Rewards program, and this is something, and I've been with USU for 3 years. So this rewards program has been around for quite a while. I don't exactly know how many years, but they've been around for a while. But so when we met, finally, this was in like 2020 or 2021, we met. Then this is how I found out that, the rewards program, they were having low participation, especially from off-campus faculty. So faculty on campus, they loved it. They did it. They participated, they were doing all of the activities, but there wasn't a whole lot of participation from faculty and staff who worked in the satellite campuses around the state, and also the extension offices, specifically extension as well, because most of these activities that they had available on their website were available on campus only, and there were very few virtual options. And I found out that they were interested already. At that point, they were interested in expanding and partnering with Extension, because the coordinator knew about Extension, knew the connection we had in the counties. And so they found Extension to be a good partner to help increase, kind of get that increased participation, basically. And the time frame I'm talking about is, like I said, 2020 or 2021. So this was the days of lockdowns, and nobody was doing anything. Everybody was working from home. And so it became kind of a bigger deal. If you're working from home, you can't be on campus, but you don't offer a lot of virtual options to participate, then it really does limit the effectiveness of that rewards program. In 2020, as kind of a response of the fact that we're all working at home, I started with a group of faculty. There were 4 of us. We developed what's called the Daily Dose of Wellness program. And so we started to help faculty who are working at home. We developed these virtual sessions. They were 15-minute sessions, Monday through Thursday, so just 4 days a week for 15 minutes. Usually, I think it was like around 3 o'clock, when you're normally just you're just trying really hard to make it to the end of the day. We focused on mental and physical activities that can be done at work, or can be done in front of your computer or whatever. It was just a time for people to get away from work and stand up and get up and do some mindfulness exercises, relaxation, do some chair exercises, do some light stretching, Tai Chi. We had those kinds of things. So that's what we did. And we piloted this for about 4 months. We stopped at about the time when participation was starting to drop off a little bit, and we were starting to come back into the office after a couple of months. And around that same time, we realized it was really not sustainable to do it the way that we were doing it. And we wanted to partner with Be Well because they have a sustainable format. They already had something in place. They had the infrastructure. They have staff, meaning that like their exercise classes, they have personal trainers and instructors who teach the exercise classes. If any of their financial education or financial management sort of classes, they have connections to financial experts, and helping with retirement and all that stuff. And so they had the staff, and of course the rewards. You're trying to incentivize people to be able to participate. So it just really helped that we had this one program that wanted to kind of contact extension, but it was just getting on the back burner. We had the daily dose program that wanted to go with Be Well, and when we came together, we learned that we've been wanting to partner all along together. So like I said, we started working together actually in 2021, and we as a group really helped the Be Well. We really helped the rewards program, or that the coordinator, in 3 main areas. So we consulted on the website and the rewards program. So meaning that we provided guidance on providing inclusive language in the descriptions and the activities and things, offerings to the employees. We suggested adding activity opportunities for off-campus faculty, meaning that if you work in a campus, if you work on one of the satellite campuses that's not on the main campus, then you might not be able to go to a fitness class, but maybe you can go to your local gym, or you can go to another organization that is doing these classes, and you can attend that class and it'll count. That's something that didn't count before. They also added a create your own activity. So again, and even with extension, especially with extension employees, we had the opportunity that, if somebody went to a fair, or they did a 5K or something like that, something active, or they went to maybe a retirement seminar or something in their county, then that wasn't listed as an option, but they could count it as under the create your own activity. And then we also offered more virtual options of these in-person activities. So for example, like the assessment, one of the assessments that they do that everybody does at the beginning, they can go to a doctor and do an assessment, but now they added a link where they could do a virtual assessment, or like a questionnaire or something that would count just as well. So there are virtual options of these in-person activities. So we consulted on that. And that was the first biggest kind of hurdle to make sure that people off campus knew that this rewards program was for them as well. We connected extension faculty to provide the content. So like I said, they have staff, but their limited staff cannot provide all of the education that would be available. And there's content that extension teaches that their staff maybe did not know, or they didn't think about, like, some topics that faculty or that employees were really engaged in. So we had connected our extension faculty to the Be Well Rewards program, where they could provide workshops, they could provide educational classes. These were done on Zoom, and then recorded and then available online for later viewing as well. We also have an extension calendar, a main extension calendar, and now the website advertises that extension calendar. So it really helps people who are off campus and in the counties. They can see what's going on in their county, and so it kind of helps even improve extensions participation, but and also help connect faculty to, or employees to, those opportunities. And then lastly, we helped create an evaluation to measure outcomes and impacts. So they had done an evaluation but they wanted to measure more than just, what you like about the program, what didn't you like about the program, did you do it, what kept you, those kinds of questions. They really wanted to know, did it actually help? Were you able to save money? Were you able to meet your health and wellness goals? Whatever those things were, then they looked at hydration, they looked at healthy behaviors, they looked at lowering unhealthy behaviors or decreasing them. And so there were this evaluation was a little more robust, and so that's something that we helped create. And then they were able to send that out to the employees who participated in this. And so that's really kind of a really simple, quick and dirty rundown of how Extension partnered with the Be Well Rewards program to make it more accessible and available. So if you would like to check out the Be Well Rewards program, the website I have up here, and I think it's also in the chat. And thank you. And then if you'd like to learn more about Be Well and maybe do something similar or find out more information, you can contact the Be Well office. But if you'd like to learn more about Extension specifically and how to get Extension involved in maybe your university's employee wellness program, then just shoot me an email, and I'd be happy to talk to you about that. And that is pretty much it for me. So I am going to turn it over to Adam. Thank you.
Hey, everybody. My name is Adam Hughes, and I will be rounding out the day for presenters. So I will jump right in. So my talk today is about building public health and well-being capacity, similar theme to the other two presenters. So a quick overview. Again, my name is Adam Hughes. I'm actually from outside of Extension, so I've only been with an Extension for going on 6 years now. My background is in public health. I've worked in a number of different contexts of public health, all the way from sort of direct service street outreach worker, all the way up to regional and state health policy. And then I came to Extension, like I said, back in 2018. And it was actually a really interesting time. And we'll get into that time. So we'll talk about that time and how it led to Cooperative Extension, Cornell Cooperative Extension's expanded role in community and public health. We'll talk about the development of our program work team, the 4 needs that were identified by that program work team, along with the response for some of those, which include capacity building at the local level, public health workforce development, both utilizing cooperative extension and building it locally, communicating our work through a public health lens, and securing funding across our system. Our system is a little different than some systems. We are a fully decentralized system, so we have 56 county offices that are all independent employers that operate under the 501c3 of Cornell University. So securing funding both at the state and local level is 2 separate processes, but need to work in tandem. We'll talk about the collaboration with Cornell's Master of Public Health program, which is a relatively new program at Cornell out of the vet school. And lastly, we'll talk about the Public Health Essentials eCornell curriculum and how we've used it in application to work on some of these identified needs. So again, when I came on in 2018, it was right during I don't want to say peak because it's really ongoing and there were dips and valleys of the opioid crisis pre and post pandemic. But during that time, when I first started, the USDA was one of the 18 federal agencies mandated in the response to the crisis. I'm sure this is not news to many of you who, as we all have sort of worked in this area in extension. So I came on board as the state extension specialist who happened to have a public health background. And so I sort of stepped in to help lead first the opioid work, which led to some statewide trainings and partnerships with New York State DOH, Office of Addiction and Substance Abuse Services, and Office of Mental Health. And then during COVID, that opioid work really broadened out to be more broader community and public health. So back in 2019, we developed a program work team. So I'm sure many of you have these sort of mechanisms at your extension as well, where program work teams are teams that are developed around a topic area. They have a faculty person as a co-chair and a leader out in the county offices co-chair. And so that program work team initially started as an opioid program work team. And again, when COVID happened, our system and Cornell University as a whole was really tapped in the COVID response, which led to the Public Health Essentials curriculum, which I'll get into in a few minutes. But so we brought in that opioid PWT to a community and public health PWT. And we quickly realized we needed to build capacity in our system, both in terms of the workforce and ability to be responsive to things like pandemic, but also our ability to just talk to our community public health partners in that sort of public health language through that public health lens, which would help more quickly move towards being an explicit partner and help us articulate how we are that explicit partner in public health. So this program work team, once it became the community and public health program work team, began offering quarterly meetings. We began with a needs assessment to inform its direction. We've done a number of different things. I saw David Byes was mentioned earlier in one of the presentations. He's come to join our group to help talk about what other extensions are doing in community and public health. We've also had a series on different topic areas. Right now, we're doing a series on mental health because we just hosted the National Health Outreach and Engagement Conference, and there was a really clear theme of mental health programming happening across the country in extension. And again, so we touched on those identified needs that came out of the needs assessment, that capacity building at the local level, public health workforce development using cooperative extension, communicating our work through that lens, and securing funding. So we did a few of these things, and I'll talk about what some of that looked like. So early in the PWT's existence, the partnership between CCE, Cornell Cooperative Extension, and the Cornell Master of Public Health Program developed. I had a lunch one day with the associate director of that MPH program, and we are both super passionate about public health and see cooperative extension as a untapped or underutilized resource to really disseminate prevention and education, public health work. And so that partnership started over that lunch, and separately, early on, Cornell was actually in communication to get all of the contact tracing funding that all states got in some form or another during COVID. That ended up going to another entity. But what the governor's office did ask the Master of Public Health program to do at Cornell is to develop this public health essentials program. So in our response, New York State's response to COVID, we recognized, as the nation did, that in times of pandemic and other public health crisis, we are underutilized. We do not have enough capacity at the local level to roll out comprehensive public health programming when needed. And so the New York governor at the time wanted to put together a public health essentials curriculum that could be implemented with non-public health people, but human service professionals, to really ground them in public health, give them the ability to speak that language of public health. And so that was developed separately, not in concert with cooperative extension, but as soon as it went under development, Dr. Jen Meredith, the woman who I referenced, the associate director of the MPH program, came to me, and we were already talking about ways to build local capacity and ways to build public health workforce. And this public health essentials curriculum was really able to do both. So we ended up going for funding in a number of different ways to implement this public health essentials curriculum as a mechanism to build internal capacity and build workforce at the local level. So we did get some funding streams. Some of them, many of you who are on this call may actually receive this funding. So we got the Rural Health and Safety Education funding. So that's the RHSE funding that is funded to cooperative extensions. It's released, I believe, every year. It has been released every year since I've been on board. And so we applied for that to use the Public Health Essentials curriculum with 3 of our county associations: St. Lawrence up in the North County, Steuben County, which is in the southern tier, Finger Lakes area, and Sullivan County, which is in the Catskills. And our cooperative extension office recruited a team of folks to go through this Public Health Essentials curriculum along with cooperative extension staff as a cohort. And at the end of this, going through this 16 module Public Health Essentials curriculum together, they would basically do a quick needs assessment and work on a project with this mobilized public health team that was put together and capacity built through the grant. So that has been a really successful grant. We're actually waiting to hear about funding, a second round of funding for the Rural Health Safety Education to almost do like a train the trainer, where those original 3 counties would become mentors to 6 to 9 new counties to do the exact same thing in their counties using this Public Health Essentials curriculum. And then also separately from that, we worked with Roger Renkamp and were able to secure some Robert Wood Johnson Foundation funding, which, as you know, RWJF has invested a ton in extension and moving extension more and more into public health work. And so they made some funds available for the Public Health Essentials curriculum to be used as a mechanism for the CPH certification. And that was actually in partnership with David Buys, because David Buys actually sits on the certification board for the Certified Public Health Certification. And at the time in which Roger, Jen, and myself were talking about uses for this curriculum, David was working with Roger to find a curriculum for this mechanism to roll out with an extension. So we've used Robert Wood Johnson Foundation funds to have folks from educators from across the country taking this Public Health Essentials curriculum to build their capacity in preparation for the Certified Public Health test. So those are 2 quick and easy examples of how we've sort of just leveraged this this curriculum that was developed by the Master Public Health Program, and it's really doing multiple of those goals: building that local capacity, building internal capacity, helping people speak the language of public health, and talk about how social determinants of health and the work of extension are completely seamless in their framing. So as far as continuing efforts, as I mentioned, we are waiting on that additional RHSC grant, but we're also exploring other state, private foundation, and federal dollars to continue to leverage that curriculum. Also, one thing I didn't mention was that when that curriculum, before it went live, our system, Cornell Cooperative Extension, was given 25 seats to pilot the curriculum. So even during the piloting phase, we were able to leverage the curriculum to build some internal capacity within our system. And our PWT is about 150 people strong in terms of the listserv. We get a solid, continuing group that attends the quarterly meetings. So we continue to see our system move more and more towards that ability to articulate ourselves as that explicit public health partner. There is a link in this slide deck to the Public Health Essentials Certificate Program. So please feel free to explore that. And that is all I have. Otherwise, look forward to any questions and how Cornell Cooperative Extension can help other extension systems do the same in terms of building capacity and continuing to talk about our work through that public health lens. So I don't know who I'm turning it back to, because there is
no. Thank you, Adam, so much. And we're going to turn it over now to Nancy for our questions, and hopefully we'll be able to have our panelists answer the questions. Nancy, do we have any questions in the chat?
We do. Thank you to all the speakers and to the audience. We have some questions. And we'll have a few minutes. And I just want to remind everyone that if we don't get to all of the questions, information for each speaker has been provided in the chat box. And so you are encouraged to reach out to each one of them as well. But we're going to start with a question for Samantha. Can you please talk about the listenership of your podcast, and can you determine extension's participation?
Sure, thanks for the question. We are not yet officially doing any type of dissemination science study related to it. I'm mostly using kind of the passive data collection that the hosting site provides. Of course, I have some great qualitative or anecdotal data, but we're really building. It just ended the first season, and the second season will launch on September 1st. So there'll be some coverage around that, but just continuing to tune in. As the description says, there's interviews, but there's also meditations and musings. So there's things like 12-minute meditations or movement opportunities that you might want to use before you do a presentation or whenever you might be experiencing stress. So it's not just a podcast, but it's also an opportunity to bring those mindful movement opportunities kind of asynchronously on demand for you. So thank you for the question.
Thank you. That's great information and resources that I hope everyone is going to be able to access. Our next question is for Gabby. And can you please talk about outcomes and impacts that have come from participating in the Be Well program?
Sure. Actually, there were two different surveys that were sent out. The Be Well Rewards program ended up sending a survey out to everybody who was not, I think everybody who participated, but that was sent out pretty recently. So and the coordinators on maternity leave, so I don't have the results of that. But my colleague who works in the sociology department, she sent out a separate survey that was just for those in extension who participated. And we do have the results of that. And basically, it helped. Generally, it was positive. People who had participated, they had done all of the activities, they completed it, meaning they met all of the requirements for officially completing and then getting the incentives and things like that. So we do have a good chunk who did complete it, about over 50% at least who completed it. Most of those still say that there's still some work to be done with making it more inclusive, especially for those off campus or not on the main campus. Then there's still some opportunities for that, but they did have more chances to participate in different community events and things like that. The program itself, them participating in the different activities, really helped them engage and improve their physical activity and their exercise. It also did a good job with including activities that promoted positive mental health or good mental health and well-being. They had also stress reduction and work-life balance, those kinds of things. I think got the best, kind of the best feedback from the respondents. So all in all, I think it went well, especially since this was the first survey that was given out since the program was kind of expanded. Even if that was in 2021, there's still time. It took a good year or so for everything to be implemented and ready to go. So I think it was a good first try, or first attempt, and then we still have some work to do. So we'll keep working with the reward program coordinator and keep making it better.
Thank you so much. And if we still have time for one more question, we'll give that to Adam, Emily. And so, Adam,
Yeah, go for it.
how long is the Public Health Essentials curriculum, and what kind of time investment to complete?
Yeah, so it's they've broken it down. So it's asynchronous. So a lot of it you can do on your own, and you can do it through your you do it cohorted, and you can do it in about 4 to 5 hours a week across a couple months. You can do it faster, but that's the pace that we do it with the Rural Health Safety and Education Grant. Because it's asynchronous, you can do some of it at your own pace.
Okay. Well, we'll pass it on to Emily as we're closing down on our time. Once again, we appreciate the speakers' responses, and we're encouraging everyone to connect with them. Their presentations and recordings will be available in the webinar archives page.
Thank you so much, Nancy, and thank you to all of our speakers and facilitators today for sharing, and thank you to all of the attendees for coming in and listening today for our 2023 virtual summer school. Like Nancy said, our speaker contact information has been shared via chat throughout. Once we get the recordings processed for closed captioning, we'll post them on the National Association of Extension Program and Staff Development Professionals archive, along with the recordings over the course of the week. We appreciate all of your feedback on today's session. And there's a few different ways you can provide that feedback today. You can follow the link in the chat for the evaluation, or you can also, if you want to kind of whip out your phone, and it's a fun QR code, scan that QR code, and that will bring you to the evaluation as well. And I just wanted to kind of invite you all to attend our tomorrow's virtual summer school session, which is entitled Fostering Healthy Partnerships. That session will feature 4 programs from Oregon, Puerto Rico, Texas, and Wisconsin extensions. It will explore how these programs have successfully developed partnerships with local agencies and organizations to address community and health well-being. You can sign up in the chat as well for that, and also on Friday's session. Thank you again to all of our speakers, facilitators, and to everyone who attended. Have a wonderful day, and we will hopefully see you tomorrow.